In order to even begin addressing global goal number 3, which is good health and well-being, and even the more specific goal in that, which is increasing health financing for developing countries, I think it's crucial that we first talk about the main barrier that people face when trying to achieve this goal, which is actually accessing health resources. Access to comprehensive and quality healthcare services is really important for promoting and maintaining health and preventing diseases that are actually very preventable with basic healthcare that these countries just don't have. In order for someone to have quality healthcare, they must one, be able to gain entry into the healthcare system, and two, be able to access a location where healthcare services are provided. To accomplish these two things, you usually have to have insurance and some level of financial stability, which a lot of people in developing countries just don't have. For many of us, accessing healthcare is pretty easy. If you feel sick, you can drive just a couple miles to the doctor's office or free clinic, and you're usually taken care of within a day or two. Well, for over 400 million people, this is not the case. That's right, just a couple years ago, the World Health Organization released a report stating that 400 million people, which is 6% of the entire population, don't have access to health care due to either lack of insurance or geographical distance, the two most important things that you need to get adequate health care. At a national level, poorer countries tend to have less access to health services than wealthier ones. A statistic that's almost hard to believe is that developing countries account for 90% of the global burden of disease, but for only 12% of the global spending on health. High income countries spend about 100 times more on health per capita than low income countries, the difference being over $3,000 per person annually. It is thus not surprising that the density of health workers and hospital beds per population are much lower in developing countries than in high income countries. This is demonstrated in Julian Hart's inverse care law, which states that healthcare resources are distributed inversely to their need. Furthermore, the poorer the country, the larger the amount of total health spending that is out of pocket. On average, more than 60% of the spending in low income countries is out of pocket, compared with only 20% in high income countries. This is because they lack basic health insurance coverage, which is sometimes impossible to obtain in countries where job opportunities are extremely limited and most of them don't provide benefits. Health insurance coverage helps patients gain entry into the healthcare system, and lack of coverage makes it difficult for people to get the healthcare they need, and when they finally do, it burdens them with large medical bills. Uninsured people are more likely to have poor health status, less likely to receive medical care, more likely to be diagnosed later, and are more likely to die prematurely. The poor in these countries suffer from a disproportionate burden of disease, yet they usually have less access to healthcare, whether measured by geographic accessibility or financial accessibility. A lot of these factors are out of their control, the main one being geographical distance and accessibility. An inverse relationship between distance or travel time to health facilities and use of health services has been demonstrated as a prominent barrier to access healthcare. For example, good roads, which are often a rarity in the poor areas of developing countries, are required not only for people to go to these health facilities, but also for the distribution of drugs and other supplies to the facilities. Also, lack of adequate communication service limits access to health care. This obstacle becomes more pertinent in remote areas where communication often gets cut off during adverse weather conditions. Financial access is now considered one of the most important determinants of access and is most directly associated with levels of poverty. Besides the direct cost of treatment and informal payments, there are also indirect costs that discourage the poor from seeking treatment. These indirect costs include the opportunity cost of time of the patient, which means what they are losing by taking time out of their day to travel to clinics and offices. This, for many people, is the money they would have to give up from working to go to these clinics. This is not an option for working families who barely earn enough to get by, and for whom something as simple as taking the day off costs them tomorrow's dinner. Disadvantaged groups within developing countries, such as the poor and women, also face more disadvantages as healthcare providers are more likely to treat people in higher socioeconomic statuses. The group of people that is most affected by this limited access may be the most devastating and surprising because it's actually children. Of the 400 million people I stated earlier that don't have adequate access to medical care, over half of them are children. More than 200 million children worldwide under age 5 do not get basic health care, leading to nearly 10 million deaths annually from treatable illnesses like pneumonia. The countries most affected by this are in sub-Saharan Africa, where 4 out of 5 mothers are likely to lose a child in their lifetime because they can't access health services. Children in sub-Saharan Africa are more than 15 times more likely to die before the age of 5 than children in high-income countries. One contributor is a lack of emergency care in sub-Saharan Africa. Here, Ziad Obermeyer, professor of health services at Harvard Medical School, discusses how detrimental this lack of emergency care services and training can be for patients.
And so we can draw a couple of conclusions, and here are the highlights. The volumes of patients seeking care are enormous, hundreds of patients per day in most ERs that I studied. Outcomes are not good. Illnesses are of very high acuity. To give you an idea of the magnitude, in some ERs in sub-Saharan Africa, 1 out of every 5 children that are brought in by their parents will actually die in the ER in front of a doctor who either doesn't have the training or the resources to save that child's life.
An alarming number of countries are failing to provide the most basic health services that would save lives, with 30% of children in developing countries not getting basic health intervention. In the Philippines and Peru, for example, the poorest children are 3.2 times more likely to go without essential health care than the richest children in Peru. In terms of doing things to help these people in developing countries access health care, many people are stuck on what exactly to do. The issue is so broad and multifaceted that it sometimes feels like there's nothing you can actually do to help. In reality, there are actually several ways you can get involved, and they can be as small as donating to charities dedicated to providing health packages to be sent to developing countries. If you're looking for a way to make a bigger change in the entire system, you can consider donating to health research in those countries. Finding new, cheaper ways to, for example, administer vaccines could make a huge difference in the health status of a nation. Vaccines are crucial in certain stages of children's lives, and it's crazy to think that some children never even get a chance to get any of them. Making these readily available in every developed country would significantly decrease child mortality. For example, Peru cut its child mortality rate by over 55% by making certain vaccines widespread. It's up to us to donate to these charities, organizations, and research programs to ensure that potentially devastating barriers to health access won't have time to make their mark. So donate to a local charity or a medical research project to increase access to healthcare services and make global health and well-being a given in our world.